I started Pennywise PPE as a direct response to what I saw when I was deployed to New York City as an EMT to supplement the 911 services there. They were getting overrun with COVID cases and they needed additional help, so I came over from Massachusetts. And while I was there actually was a fairly stable supply of PPE for medical staff who were working directly with the government, as I was. In addition to the states. But one area where there was really no innovation was in the storage of the N95 respirators. The N95 respirator is really the gold standard for protection in the field, especially in regards to coronavirus. And these were already in short supply, which meant that healthcare workers were having to reuse them. Now, when you're reusing an N95, you have to store it in a paper bag so it has proper ventilation. And the issue with this is that a paper bag can actually harbor the coronavirus for up to 24 hours. And if you imagine a situation where you're only wearing your N95 with COVID patients, especially if you're an EMT like me and you deal with different patients in different times and you're not always interacting with the same floor as you would in a nursing home or hospital, when you take off your mask and put it into the bag to store it, contamination can spread from the exterior of the mask to the interior of the bag. And then on subsequent storings, you can actually spread that contamination back to the mask. And that puts the provider at risk of infection and also bringing it home to their families. And this is kind of a weak link in the healthcare system that's seen across the board. It's not something limited to EMTs and nurses. It's something seen with doctors and pharmacists and emergency room technicians. It really is an across the board spectrum, and my Copper Clean bag is the first response to that. I created the Copper Clean bag as a proprietary means of PPE storage. It's lined with an advanced copper-infused fabric. Copper, if you didn't know, is actually one of the oldest germicidal substances known to man. It's been used since ancient times. The Phoenicians actually used it to sterilize their wounds after battle by shaving off parts of their bronze swords. And then in India, water has often been stored and drank out of copper mugs because of its antibacterial and antiviral properties. And then even in modern times, look to your water pipes. Most of them are made out of copper, and it's again because it keeps things clean. And we're just taking that same tried and true scientific concept that's been used by humanity for thousands of years, and we're applying it to the most modern problem, which is coronavirus. And we're making sure that the storage and safety mechanisms in place for our providers are actually keeping the PPE they need safe. I'm sure that you and everybody else who's watching this is thinking it's the clown. But in reality, it comes in large part from the copper use in our products and also the saying penny wise, not pound foolish. The penny refers to the fact that all of our products use copper as our antibacterial and antiviral surfaces. A lot of other products, they use either sterling silver or they use some sort of artificial means of germicidal surfaces. These are oftentimes not as effective. For example, sterling silver has to be wet for it to even be an active germicidal agent, which makes it completely ineffective at being like a doorknob or a kitchen table or something like this. Like, who wants to store their mask in a water balloon? Nobody. So after we nailed down the penny part, you think about the saying penny wise, pound foolish. Our bags are cheap to buy. They're only $25. They're not the exorbitantly priced medical equipment that you see traditionally. And that's because it's a small investment in your safety for a tried and true method of sterilization. And it's the penny wise decision, not the pound foolish decision. Yeah, it might be $25 up front, but even if you're looking at it from a facility standpoint, like let's take AMR, for example. I work for AMR. The average EMT is paid about $13 an hour. If you got 1,000 of these bags and you distributed them to 1,000 of your EMTs and it prevented even 6 infections from the coronavirus, the money you saved on those employees' 2 weeks off because they're afflicted with the coronavirus would have already paid for the money up front for the bags. These are an investment in your future, they're an investment in your employees' safety, and they're a stopgap in case the PPE supply chains aren't up to snuff. And so far, they haven't. Touched on a really important point, and that's that this product is intended for state and local governments. It really isn't a federal product in the sense that this is most applicable to first responders. So fire, EMS, traditionally parts of government that are operated on the state and local sector. And in addition to that, because of the PPE supply chain difficulties, most of the procurement has actually transitioned to the state and local sectors. So what we're saying is that this product is something really easy to add on to your existing PPE procurement plans. And because the supply chains aren't set in stone and you don't know if you're going to be able to get that next mask, ensuring that you have the means of storage to provide your employees with to make sure that the supplies you do have can last as long as you intended, and if necessary can be stretched. I'm sure you've seen the COVID numbers, I've seen the COVID numbers. They're getting worse and worse every day, and the PPE is going to be used up more and more every day, and we need to really make sure that we're putting in place measures not just to make sure we have enough PPE, but to make sure the PPE we have is stored safely. And on top of that, if we're talking about the federal government, I think that this is a perfect product to have in national strategic stockpiles. It is not enough to just have N95 respirators stored up in storage for a long time. We saw that this time. The only respirators available to lots of hospitals were those left over from the Ebola pandemic. And while the masks themselves don't deteriorate over time, the elastics that are on them do. This is made with nylon and polyester, among other things. And those fabrics do not deteriorate over time. This is something you could keep in a strategic national stockpile for decades with absolutely no detriment to its effectiveness. The copper will still be germicidal. It will always be germicidal. That is just how the fabric works. And in that regard, it makes it a really advantageous purchase for something like pandemic prevention, which happens roughly every 100 years. So it's not something that you want to fill your stockpiles with goods that can go bad. And this is where this really fits that niche. And it's another stopgap to make sure that the supplies you do have are stretched out enough. I can give a little bit more detail in regards to our UV clean bag. This is an idea that we pitched to the Department of Homeland Security and we're currently looking for funding for, but it's kind of in holding as we focus on the launch of Copper Clean. But it is a bag lined with UVC LEDs and equipped with a battery that's actually able to sterilize masks on the go in 60 seconds. And this is much different from traditional sterilization that is available to most hospitals, in that it can actually be used quickly in between patient encounters. So you're not just using the dirty same N95 mask all day and then sterilizing it. You're actually able to see your patient, sterilize it, see your next patient. And while this may seem like a trivial aspect of decontamination, this kind of steady, consistent cleaning is really what tips the scales in favor of the healthcare workers when they're battling the coronavirus. And it also keeps your patients safer. At the end of the day, if your providers are out sick with coronavirus, then there's nobody there to take care of their patients. And that oftentimes leads to the hospital overload becoming more and more exacerbated. I think that if I were to speak directly to your government audience, I would say that don't forget about those tertiary healthcare workers. A lot of the time when you're hearing about Thank Our Heroes, it's always about the nurses that you see in ERs and the doctors you see in ERs and the EMTs bringing them into ERs. But there's a whole nother segment of the healthcare working population that actually is playing a bigger role in the coronavirus pandemic. And that is your skilled nursing facilities and your private EMS. Private EMS does most of the dialysis transfers to and from skilled nursing facilities, as well as transporting those patients from skilled nursing facilities to their doctor's appointments, to the hospitals. And then on the other hand, skilled nursing facilities are monitoring most of the elderly population that needs that level of care. And in addition, they're one of the most poorly funded parts of the healthcare system, both skilled nursing and private EMS. And the coronavirus has shown that when these institutions aren't properly supported, bad things happen. A perfect example is if you look at the Soldiers' Home incident in Boston. That was a nursing home where you had the most deaths in the States simply because there wasn't enough staff at the nursing home, because they're not able to pay their employees enough wages, which is a separate problem. But then they're forced to combine their staff in the patients into one unit, COVID cases spread, and you have an outbreak. You need to be able to show your staff at these facilities that you care about their safety. And one of the ways to do that is to give them the means to reuse PPE that they don't have a lot of. I work in private EMS. I know how it is in the field, and you're given one N95 maybe a week. If you're in a skilled nursing facility, oftentimes you have to scrounge for your own. And in situations where you are the forgotten wing of the healthcare world, getting given the means to protect yourself even when the supplies run out is a really powerful thing. And we've seen most of the coronavirus deaths in this country come from elderly populations, mostly in skilled nursing facilities. And so, if it was one last thing to say to government officials, it would be to not forget about those healthcare workers that are supporting some of the most forgotten patient populations and also some of the most vulnerable to coronavirus, and make sure they're able to store their PPE in a safe way.